Welcome to our Galway Clinic OrthoInfo Patient Information Series, being delivered to you by the Galway Clinic in partnership with Professor Cathal Moran. Cathal is a well-known consultant orthopaedic surgeon, Professor of Orthopaedic and Sports Medicine, and a specialist in the management of pain and injury of the shoulder and knee. Cathal, delighted to be here with you today, and thank you for joining us with this discussion on shoulder pain and injury.
Delighted to be here as ever, and it is nice to help our patients however we can and share whatever information both today during the chat and at any stage in the future.
Cathal, what are the most common causes of shoulder pain?
Well, I suppose that's the big question. I mean, there are a myriad of causes of shoulder pain, to be honest. Some of them exist from within the shoulder itself and some come with outside. Classically, somebody might get some neck pain with some pain radiating down to the shoulder, nerve root pain and so on. But if we think about the shoulder itself, admittedly, a lot of pain does come from it. Here, the shoulder joint. Thankfully, the shoulder joint is not like the hip or the knee. It doesn't classically get a lot of osteoarthritis because it's not a weight-bearing joint. The arm bone essentially hangs away from the socket. But one could have some wear and tear, or wear and tear of what we call the labrum or cartilage of the joint, which can cause some irritation. Around the biceps, you can get a little irritation. But classically, most shoulder pain actually comes up from around the top of the shoulder here. Here we have the collarbone and the shoulder cap, or acromion as we call it, and that's known as the AC joint essentially. Here within it we have the supraspinatus tendon. The supraspinatus tendon is one of the big rotator cuff tendons of the shoulder joint, and classically over lifetime, as we repeatedly lift our arm, if you can imagine that arm lifting out, that tendon can get pinched here a little between the shoulder cap and the arm bone, and essentially that can cause some irritation or tearing of the rotator cuff, or other type of conditions that are in many ways related to that. The other classic problem that people can have is actually what we call the capsulitis, or what is more in layman's terms perhaps known as a frozen shoulder. And essentially what a frozen shoulder is, where the lining of the shoulder joint, the capsule of the joint, can become inflamed and can become very painful. I suppose there are many other causes as well, but they're classically the big ones that we see outside of people injuring their shoulder acutely or having a fall and so on.
Cathal, many people have shoulder pain, but they don't remember injuring their shoulder. What may cause this pain?
Yeah, well, I suppose it goes back to that idea again. We do see a lot of athletes and players who do have sudden injuries or falls, but they classically will recall a tear or a pop or something like that, or a dislocation of the shoulder and so on. But the majority of patients that I see at my clinic, and I suppose are seen right around the world, are probably these wear and tear conditions. Essentially, the tendons can become inflamed, they can get a little pinched, can break down, and a lot of this happens with a lifetime of wear and tear. Old minor injuries in the past the patient may not even recall, may come back to haunt them a little bit. But in many cases the reassuring thing is that these are relatively common, they're relatively normal, and that in the majority of cases patients can actually rehabilitate or exercise their way through them with appropriate guidance without having to go the surgical route.
Okay, Cathal, what can patients do to help reduce their pain, and should they exercise?
Well, if we take it back a step, I suppose the first thing is if it becomes acutely sore or inflamed and so on, it is important to maybe rest it a little in the early stages. But certainly, once you go beyond that, we do believe that exercise and movement is very important. And in fact, that's probably one of the single biggest reasons patients do come forward for consultation, to see what they can do. And I find that many patients either have been advised, or they feel they might have been advised maybe to take it easy and not use the arm, but typically that can actually aggravate the problem more. But classically, if one is going to take exercise for a sore shoulder and so on, it is important to follow a structured program. They're typically led by physiotherapists, by physical therapists, personal trainers and so on. We can share guidelines with them on what should be done and what should be followed. But thankfully, exercise is important, but usually under guidance. If you have any red flags, though, I would say, by that I mean severe pain radiating down the arm with weakness, if you have any swelling of the shoulder, redness and so on, I suppose we do recommend that you get checked by your GP or by your physiotherapist without just assuming that it's a wear and tear condition.
How would a patient know if they will need surgery on their shoulder?
Yeah, I mean, we do a lot of surgery, and I suppose as a shoulder knee specialist, I do a lot of shoulder surgery, and at the end of the day, that is what my specialty is. But in the early stages, we will always try and encourage people to go the non-operative route. Yes, in the case of athletes or injured players or people at a young age who have a fall and a tear and so on, we do go early to surgery and fix that because it will tend to give them the best results possible. But at other time points, if we feel that the problem is more of a wear and tear situation, we certainly will advise the least intervention possible first. Exercise is the way to go, as I say, but guided exercises. Sometimes we'll use injections, sometimes we'll use pain relieving medications and so on. And we have a whole world of what we call biologics now, where we use cells and gels and so on as well to try and help with some healing, or at least help with pain-free episodes where they can do their exercise and rehabilitation. But in terms of surgical, I suppose the surgical option then really comes up to play when, I suppose, the story matches in well with the examination, when the imaging findings, be it on X-ray and MRI and so on, are found to be in keeping with that, and when we feel the patient has tried the least invasive options possible. Finally, of course, the pros and cons of surgery have to weigh up to the patient. They need to understand maybe the practical implications of taking a few days out, or maybe having their arm in a sling, depending on the procedure that needs to be undertaken, and the need for exercise and rehabilitation afterwards. So they're the type of areas we cover before making a decision together.
At what stage in the patient journey should they come to see a shoulder specialist like yourself?
Well, they're welcome at any stage, I suppose, but I think where we're probably most effective at helping people is after they've maybe trialed those initial therapies, be it exercise therapy, be it anti-inflammatories and so on. And a lot of that can be guided by GPs and physios. But sometimes patients do like to come to see us early in the process, if only for reassurance around their condition and that we guide them. Sometimes it's useful for us to meet them in the early stages and then encourage a non-operative route, so that at least we know when we meet up a second time that we've gone down that route together, gain some confidence in our various approaches, and then take on a surgical procedure if and when that's necessary.
Cathal, thank you so much for your expert advice on shoulder pain and injury. Delighted to have you here with us today.
Delighted to be here, Claire. Always good to chat, and delighted to help patients however we can anytime.
Today's OrthoInfo Patient Information Series has been brought to you by the Galway Clinic in partnership with Professor Cathal Moran. For a consultation with Cathal and treatment at the Galway Clinic, please see our contact details shown here.